Hi, I'm Dr. John Legaretta, and welcome to the I-911 show. Today we're going to be talking about corneal abrasions, so let's get started. Corneal abrasions tend to be one of the most common eye injuries we encounter, accounting for approximately 10% of eye injuries, but they also tend to be some of the less serious injuries encountered. It's important you take the necessary precautions as well as treatment when you sustain a corneal abrasion. In today's episode, we're going to talk about what is a corneal abrasion as well as how we treat it. So what is a corneal abrasion? A corneal abrasion simply is a scratch or scrape of the cornea, which is the clear or transparent tissue in the front of the eye. This tissue, the cornea, has lots of nerve endings, and when it's damaged, those nerve endings send a pain signal to the brain indicating that something's happened to the cornea. This can be extremely painful. Well, corneal abrasion can be caused by many things. Some of the more serious issues are trauma, such as a blunt force trauma from a fingernail or a tree branch, which can either scrape or scratch some of the corneal tissue right off the front of the eye. Other things, such as foreign bodies, metal, sand, dust, can get in the eye, and then either when the eye closes over it or you inadvertently rub the eye, then a scratch or scrape of the cornea can occur. Additionally, if your eyes are extremely dry or you have severe allergies that can cause dry eye, sometimes just the fact of opening your eyelids in the morning or again rubbing them can cause a corneal abrasion to occur. The symptoms of a corneal abrasion vary depending on the severity of the abrasion itself. So more mild scratches or abrasions tend to have less symptoms. Some of these early symptoms or more mild symptoms can be simply tearing of the eye or a little bit of pain or a sensation that something's in the eye called a foreign body sensation. If the corneal abrasion is more severe, either by size or a deeper cut into the cornea, then the symptoms tend to be more significant, including light sensitivity, tearing, a foreign body sensation, but also blurring of the vision or temporary vision loss. Well, corneal abrasion needs to be diagnosed by your doctor. They will perform an eye exam where they check your vision as well as your eye pressure, and then take a look at your eye under a microscope called a slit lamp. During that examination, typically a special dye called fluorescein dye will be applied to the eye to show any cuts or scratches on the eye itself. How do you treat a corneal abrasion? Well, depending on the severity of the abrasion, there may be several different treatments employed to help the abrasion heal and prevent it from recurring in the future. Number one, artificial tears. If it's a very minor injury or it's not very significant at all, sometimes artificial tear or lubricant eye drops can be used to lubricate the eye surface to help with the healing process and prevent from the abrasion from reopening. Number two, antibiotic eye drops are typically used when the abrasion is more significant to prevent infection. Sometimes this is in a drop format or in an eye ointment format to help with pain control as well, again, prevent infection. In certain cases, when the corneal abrasion is more severe, sometimes eye patching is employed, and this is really to prevent the eyelid from mechanically rubbing against the area that's open and preventing it from healing. Typically, an eye patch with gauze and tape is applied for a day or two and then monitored to make sure the abrasion is healing appropriately. In a similar fashion, sometimes a bandaged contact lens is applied to the eye, again to provide a barrier between the area that's open or raw, the abrasion, and the eyelid itself from rubbing over that area, preventing it from healing. This tends to be employed when the abrasion is more severe because it can be a form of pain control as well as also helping with the healing process. Lastly, dilating eye drops sometimes can be used to help with pain control during the healing process. A corneal abrasion is a relatively minor injury in most cases. It usually takes a few days to heal, but larger abrasions may take more than a week depending on the severity. Although the healing process can be painful, there are some steps you can take to help with it and prevent future recurrence of the abrasion. You don't want to rub your eyes. You want to avoid this at all costs. Rubbing your eyes can make the abrasion worse and impede the healing process. You don't want to wear contact lenses during the healing process. The contact lenses sometimes can interfere with the healing, and If you are going to have a bandaged contact lens placed by your doctor, it needs to be monitored closely to make sure infection does not set in. As a preventative measure, wearing safety goggles or glasses when playing sports or performing certain activities can also be helpful in preventing corneal abrasions. Remember, if you sustain a corneal abrasion, it's important that you seek prompt medical care in order to diagnose and treat the abrasion to prevent further complications and long-term issues. Thanks for watching the video. I hope it was informative. Please like the video and subscribe to our channel below to learn more and be alerted to new videos that post from our channel. Take care.